Okay, good morning, everyone. Good morning, Sunrise Rotarian. All right, we're going to get started this morning with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I believe is Ruthie not on yet?
Yes, I'm here.
Okay, aren't you going to lead us in prayer today?
Yes, I am.
Yes, ma'am. Thank you. You can go ahead.
All right, thank you. Heavenly Father, thank you so much for this day, God, and thank you for just the opportunity to come together this week, even via technology. No, God, as we come together this morning, we are very mindful of the things going on in our world, God, that seem overwhelming to us, that are perplexing to us, that, God, just cause us angst and grief. But God, we just bring those things to you today, knowing that you are the knower and healer of all things. And God, we just rely and lean into you during this time that really most of us have never experienced before, as the things we have in 2020. So just be with us. Give us wisdom to know how to lead, guide, and direct those in our own personal worlds. And God, we again continue to look to you for direction and guidance. Be with us during this meeting, and be with those that cannot be with us this morning. We love you. We thank you. We ask all this in Jesus' name. Amen.
Amen.
Thank you, Ruthie. That was beautiful. Dr. Johnson, I see that you're on here. Do you want to give us a brief update?
I can give you a little quickie. There have been a few more active cases in Bradley County. I think we're up to like 161. That's been between a 6 and 10 per day number over the last probably week. No real answer for why. There have been 3 more hospitalizations in the last week, which again is a pretty small uptick, but has gone up just a tiny bit. Everybody worries a little bit about looking at Hamilton County and their increased numbers. I would say that a lot of that is in clusters. Looking at the breakdown from Hamilton County Health Department, it's been more in Hispanic community and some of the poorer communities that are primarily Black than any place else. So it's a concern. And I think it's one of those things we ought to still keep taking the precautions, masking, which is pretty non-evident in Bradley County, seriously, and still looking at not just ignoring it. So that's about where we stand now.
Okay, thank you so much for that. And our very own Sunrise Rotarian, Jim, is going to be giving our program today.
Thank you, Mary.
You are welcome.
So when Jim asked me to do this, I was thinking back since we started doing these Zoom meetings. We've had our very own Doug Barry, Lee Stewart last week, and then we had Dr. Johnson talking about some very important topics. We had the mayor of Cleveland, we had the mayor of Bradley County, and the DA. And that's a tough act to follow, all those people. So you just got a grocery guy now. This is pretty, I'm sure it's gonna be pretty boring, but anyway, I'm glad to do it. I'm sure certainly glad to be talking about this. As bad as this has been, as tough at times as this has been with the coronavirus, I'm glad to be talking to you about this and glad that we live in Cleveland, Tennessee, and we're not experiencing the things that the big cities are. Otherwise, I'd be talking to you about some other things that you see what all the grocery stores and retail outlets are experiencing some of the big cities. So thank goodness we don't have that going on here. I'd much rather talk about this than our stores being looted and all that's going on. But anyway, to kind of give you a perspective from the grocery standpoint from coronavirus. That's what Jim asked me to talk about. So I wrote down some notes just about kind of what's going on over the last 10 weeks, which is when it kind of started for us. And then I'll open it up for questions. But so for us, it started on Wednesday, March 11th was the day that the World Health Organization declared this a pandemic. And when they did that, I mean, there was already things going on prior to that, but when they declared it a pandemic, that's when a lot of people started panicking. And the food supply is very important. Obviously, everybody knows you have to eat, and people started panicking. And at that point, they started coming in on that Wednesday, and our business just started shot through the roof because people were trying to stock up. And then 2 days later, on Friday, the March 13th, a national emergency was declared. And that just really, I mean, that spiked it even higher. And on that day and for the next 2 weeks, it was just pandemonium in the stores, and not just our stores, every grocery store across the nation. So you can't prepare for those things. I mean, this has never happened before. And most of the things that happen, we have some time to prepare for, but we had no idea this was going to happen. And you're trying to deal with all this with the same labor, same amount of employees that you had, and we were doing triple the volume. So it was just pandemonium in the stores, and then trying to deal with the health side of it as well. So, I mean, for 2 weeks there, it was just absolutely crazy. And then we're still up significantly, but it's leveled off some. But so at that time, the shoppers started panicking. They were hoarding. They were buying, as you know, I'm sure all of you probably went to the grocery store at some time in the last 10 weeks, and you've seen the results of that. I mean, people started hoarding, and I guess you all know probably the biggest thing people were after was toilet paper. For some reason, it was just crazy the amount of toilet paper people were buying, and just totally wiping out the shelves. I mean, we couldn't keep anything in stock. But anyway, once that started, it's kind of like I don't know, I guess it gets going. Everybody thinks I've got to have it. And if I don't get it now, I'm not going to get it. So everybody joins in on that, even if they're not panicking, they think I got to get it. So everybody was, the leaders of the country and of our state were trying to tell people that there's not a food shortage, and there's not going to be a food shortage, but that did little good to help. People were still panicking and buying and stocking up, because I think, they were under the impression they were going to be, either they were going to or had the possibility of having to be quarantined in their house for an extended period of time. Schools were called off and been closed, and kids were home, and everybody had to eat. And if you're going to be quarantined and you can't go anywhere, you've got to have food. So yeah, I understand the panic, but it was at a level that was just unprecedented. So we're trying to deal with that. At the same time, we're trying to deal with the impacts on the health, and how do we handle our own employees and so forth. How do we take care of our customers from a health standpoint as well? So us personally at our stores, we tried to avoid limiting product, because we just didn't think that was a good idea at first. But after, and our competitors started it earlier, but after a while, we had to do the same thing on certain categories like toilet paper, because people would come in and buy, they'd want to buy cases and cases, and then other customers couldn't get any. So we had to start limiting that on a few items, such as toilet paper, a couple other items. So the biggest issues for us was the labor issues and procurement of product, because they were buying it faster than we could get it in and get it on the shelves. And labor, like I said earlier, that you're doing triple the volume with the same amount of employees. You can't hire people that quick. And certainly you can't train them that quick. So, our people were working extremely long hours, and it was just overnight that this happened. So, no ramp up at all. It just happened overnight. So those were the biggest issues for us. Safety was our top concern, making sure that we were protecting our customers and our employees. So we had cleaning protocols were put in place early on, with much more cleaning and sanitizing. Every time that a cashier would have to wipe down the check lanes, and everything that was a high touch item had to be sanitized on a regular basis. The carts, cart handles and the carts themselves were being sanitized. We had sanitizer wipes, sanitizer itself out for our customers, but it was, you were running out, and that was something across the country, it was happening. So just trying to get that product was really tough. But so that became the main concern. But if you'll remember, back in the beginning, and I know Dr. Johnson would remember this, and he talked about it earlier, and I know that the newspaper did an article on talking about masks and different things that have happened since the beginning of this, and the changes that the CDC and WHO and the different recommendations that they've had, and there's been some controversy over that, and it's science, so things change. But early on, if you'll remember, they were saying don't wear masks unless you actually had the virus and were, had tested positive. And certainly in our business, if you think about it from our standpoint, and it would be the same in a restaurant or any food business, if that's what you're hearing and that's what you're being told by the authorities is that don't wear a mask unless you have the coronavirus, then if our people would have wore a mask, people coming in to shop would think our employee has coronavirus. So, we were told not to wear it. Our industry leaders were telling us do not wear it. So, of course, now it's just the opposite. We're requiring our employees to wear masks because things have changed and with the recommendations. But at that time, which was the peak for us, as I said, we're doing triple the volume, and all of our employees were totally exposed. And if you think about it from just about every other industry you can think of, with the exception of maybe healthcare and law enforcement, where they're right there with those people, especially healthcare, you're dealing with people who possibly have the virus or other diseases. Other than them, there was nobody that was closer to this than us as far as being close to people who could possibly have the virus. Everybody else was other retailers were either closed and ordered to be closed, or they were able to do social distancing to a much greater degree. But when people are coming in the store and panicking, it's wall to wall. I mean, we had thousands of customers and, tens of thousands of customers a week and hundreds and hundreds every day that you're dealing with side by side. I mean, they're coming down the aisles while you're trying to stock. Obviously, you have to check everybody out. So the cashiers are face to face with these people. And at that time, we didn't have shields up or anything because this had just happened. And you're handling their money, you're taking their credit cards, it was as close as you could be, and with triple the amount of people in there. So, huge exposure, probably more than any other industry in the country that our people were exposed to. Luckily, and I hesitate to even say this, but luckily nobody has ever tested positive in our company, and throughout our industry, it's been really no worse than the general population from everything that I've read. So thank goodness for that. But, we had some issues with labor as far as, we employ a lot of young people, high school kids or college kids that are working part-time, and a lot of their parents themselves and a lot of their parents were concerned for their safety because they're hearing and seeing all the things on TV, and they don't want their child exposed to that, when you've got hundreds of people every day right in your face and you can't wear a mask. And so I understand that, but for that reason, some of those people didn't come to work. And, we certainly weren't going to penalize them for that. We understand that, but it certainly made things harder at store level because you're trying to handle a huge amount of volume and you've got less labor to do that with. So it was a really tough time, especially for about 2 weeks there. When this first started. So at that time, if you think back to that, some places had closed down and weren't letting anybody go out at all in other states or cities. And, that was the thought that could certainly happen here too. And so we had certificates that we had to issue to all of our employees that I had to sign that was stating that they could travel. So if things were shut down and you weren't supposed to go anywhere, they would be able to travel back and forth to work because they were considered, everybody in our industry was considered an essential employee, obviously, because people have to eat. So it was I've been doing this for 42 years and I've never seen anything like this. And I've seen some crazy stuff in 42 years in the grocery business, but this takes the cake. I mean, there's nothing that's been close to this. But we had a weekly conference call every Friday since the beginning of this, and even continuing now. I've had a conference call with Tennessee Grocers Association is our industry association here in the state. And our president of that has been, from the beginning, has been in the Tennessee Emergency Management Center with Governor Lee and the other people in his administration that have been guiding everybody through this. So I happen to be on the board of directors for Tennessee Grocers Association. So I work closely with our president, and I had a direct access to that Emergency Management Association and Governor Lee. So we've had a good, for our industry, we've had in this state, we've had a great relationship there, and we're able to stay on top of things very well because of that. So that's helped a lot as far as guiding us through this, as far as, you know, what was coming, as far as executive orders, and things like that. So the main issue became keeping product on the shelf, as you can imagine. And we get trucks every other day, and we could, as soon as we could put the product on the shelf, it was gone, literally. I mean, it was crazy how much we were going through, which is a good problem to have, but it's extremely difficult to keep up with. But people were buying huge amounts. They bought things that they don't normally buy. I mean, some things are very slow movers. Some things you sell a lot of all the time, you know, obviously milk and bread and eggs and things like that. Some things are very slow movers in a store because people don't bake, they don't cook at home like they used to. And, you know, they eat out a lot. Well, that changed overnight when all the restaurants closed. So they're buying things like, you know, baking, cooking supplies that are slow movers, other than, like, you know, around Thanksgiving and Christmas, those sections pick up tremendously. But the rest of the year, you sell some here and there, but it's easy to keep up with. The yeast is an example. People just don't buy yeast. I mean, not much at all anymore. I mean, you know, a box of yeast would last us weeks and weeks because people just don't. I mean, how many people use yeast and make bread? It's very few anymore. Well, yeast is one of the things you can hardly even get now because it was selling. People were all baking at home, they're cooking at home, they're doing things that they never did before, but they had to out of necessity now. So they're buying things that, and because of that, those type of things, the supply chain was broken. So if you think about the supply chain for grocery, it's if anything goes wrong along the way from the farmer or from the production of that manufacturer of that product, all the way through, you know, the packaging of it, the transportation of it with the truckers, getting it to the warehouse, and then getting it from there to us. If anything in that chain breaks, we don't get our product, or you get very little of it. Well, the chain was breaking because people were buying product in unprecedented levels, and there was no ramp up for this. It just happened overnight. So you can't produce those things when you don't know it's coming. On top of that, you had the medical issues with people testing positive for coronavirus and staying home, or staying home because they have kids or people in their family that have the virus. So that's taking people out of the system along that whole chain. So if you don't have truckers reporting to work because they're sick or their family is sick, well, that's part of the chain. Same with the manufacturers. You know, part of the manufacturer, lots of the manufacturers were losing a lot of their staff. They're not able to produce as much as they need to produce at a time when we're selling, you know, triple the amount of product we normally sell. So, I mean, just a huge strain put on the system. And some things you can only produce as much as there is available as far as food goes. You can't grow food overnight. You know, it takes a while to grow food, whether it be animals or whether it be, you know, grain or anything else. So it was just causing huge problems, and still is to a certain extent in certain categories. But keeping product on the shelf was a big issue. And so the supply chain just was overwhelmed. You know, we don't normally think about you know, even myself, and like I say, I live and breathe this since I've been 14 years old, but you don't think about the food chain, the food supply, because it's just, in my opinion, we just take it for granted. You go to the store, you go to the restaurant, you get food whenever you want. And we're so fortunate to live in a country where that's the case. You know, that's certainly not the case around the world, but here, I mean, you never think about going to the store and not being able to get something. It's just, we take it for granted, and you don't think about all the steps along the way of what it took to get it to the store and to get it, you know, to you and to your grocery cart and to your home. but I think a lot of people were thinking about it at that time, and certainly it's brought a lot to light with what's happened. So anyway, we had some issues with transportation and with labor. You have issues in this industry from time to time that have caused problems with shortages of food. But in the past, it's been issues that are like weather related, a tornado or a catastrophe, a hurricane. So it's regional. You could have a labor strike or trucking issues where they can't get food to stores or things like that. But those are regionalized, or in a certain geographic area. This affected not only the entire country but the entire world. And we ship a lot of food overseas as well. So this is something that's never happened before. And a lot of people in the industry, everybody in the industry, every section of our industry has learned a lot from this. Not that this is something that you hope, that we hope will ever happen again. And some of the things you can't control no matter how much you plan, but this is something that had never happened before to that degree, on a global basis. So manufacturers couldn't keep up with demand. They still can't, but certainly early on it was worse. The projections for product that were needed weren't adequate. They were normally you would plan to produce a certain amount of product, and you base that on history. Well, that was all out the window, and there was no way they could produce the amount of product that was needed. So that was a huge issue. We did everything we could to get product for our customers, and things were totally different and things you hadn't thought about before. But like restaurants being closed and schools being closed changed the whole game with food. Food service, what they call food service, which is restaurants and schools and places like that prepare food, they were closed now. So everybody, all the suppliers that supply food to them had an abundance of product that they didn't know what to do with. For example, milk, cartons of milk. Well, there's millions of cartons of milk, the little cartons of milk that the kids drink at school. Well, now the suppliers have those and they've got nothing to do with them, nowhere to go with them. And that's not something you can sell at retail because it's a small item that probably doesn't have a UPC code to scan. People who wants that? We buy milk by the gallon normally, or half gallon. So that's just one example. All the restaurants, they buy their product in bulk. It's not packaged like it is, when you come to our grocery store. So all the bulk product that's packaged for them, whether it be produce, things like that, now they've got nowhere to go with it. So there was an overabundance of supply on that side of the business because of schools and restaurants closing. But yet on our side, with dry grocery products, that was where we really got hit hard. Produce has been, we've really had no issue with produce along the way. A couple little things here and there, but our produce department throughout the industry has been, not affected greatly. Meat department, yes, and I'll talk about that in a minute, but the grocery department for sure is where grocery, frozen food and dairy were the big categories that were affected. But as a result of that, we had to start thinking outside the box is how do we get product? Because we have one main supplier for all of our dry grocery product. And if we can't get product from them, where can we get product? And all our competitors were doing the same thing. Well, we've got a lot of relationships with vendors that we use that are local. So we reached out to all of them. We started talking to the vendors that are on the food service side of the business that supply restaurants and schools. And we got product from them that we could sell that even our competitors didn't have. So, for example, the milk I talked about, we bought some of that milk, some of the small pint-sized milks that they use in the school. And we got a great deal on it because they had nowhere to go with it. But we bought that, and that wasn't such a great idea. We sold some of that because there were kids home from school, and some of the mothers bought that. But we got hung with a lot of that. But a lot of other product for restaurants, meat and produce that they have in bulk, we were able to buy that and stay in business when our competitors weren't able to do so. So, a lot of things changed, and we had to really think outside the box on how can we get product to the shelf. For example, eggs were in short supply for a while. And some of you probably know you went to the store and you weren't able to get eggs. And the eggs that they supply to the food service side of the business for restaurants are like a 30-pack tray, and they're not packaged at all. It's just an open tray with eggs in it. Well, we bought those, and that's a crazy way to sell eggs, but it was the only eggs that were available at all anywhere. So we bought that and we sold them, and people were appreciative that we actually had eggs. So we were doing things that we'd never do on a normal basis, but if we can get product to sell, that's what I feel we're in business to do, is to help our customers. So we were really doing some things that are unprecedented just to try and get product. And I could go on and on about those type of things, but eggs, milk, bread, ground beef, hand sanitizer, masks, gloves, those things were just, you couldn't get a lot of that. And we stayed in business on all of that throughout by doing some of those things that I talked about. Hand sanitizer, that's been difficult, but we've found ways, and we've got hand sanitizer from some of the places that we're producing it, and we've sold them in the gallon size and things like that. But we've stayed in business on that, and it's been tough to do, but we've really had to go outside of our normal realm of what we do to try and get that product. But I feel like we did, and obviously this is my job, is to make sure that we take care of our customer. I feel like we were able to do a better job than our competitors in town, and I'm not knocking them, because this was difficult for all of us, and those are my friends. I got a lot of friends that work for the competitors, and I know the people that run those stores, so I'm certainly not knocking them. But being the only local ones in town, we had relationships with some people and some vendors that they don't, and it's just because of the way the system's set up. All of our competitors that are big chains, and they're self-supplied, so they have their own warehouses, and they're able to, they do the buying from the manufacturers themselves. We get it from our wholesale supplier, and we're not limited as to where we get our product. We can go outside and buy from whoever we need to, where they don't have the ability to do that. They're set up, it's one vertical integrated system for them, so they're not able to do some of those things. And that's one advantage we have, is that we're much more nimble, and we're more local, so we can go do some things that they're not able to do, or at least not able to do on a quick basis when something like this happens. So, to me, that was an advantage, and it helped us. And I think we gained some customers through that, because during those couple weeks when it was crazy, I was working side by side in the stores with the people, and stocking the shelves and doing everything we could to take care of it. And customers were so appreciative that we did have the product when our competitors didn't. So I think we gained some points there just from trying to do everything we could possibly do. And there were some customers that were upset that we're out of some product, which everybody was out of that product, but 99.5% of the people were so appreciative that people were in the stores working, and they were telling all the employees, and I'm sure they were doing it in the competitors too, telling all the employees how appreciative they were that they were there working throughout this, and so they were able to get product. But anyway, we did have, along the way, there was some issues with certain items. It was very few, but for the last several years, there's been very little inflation in the business with food. There's been some restaurant inflation with prices, but on the what they call food at home, is the way that the government tracks it, there's been very little inflation over the last several years, like 0.5%. So prices have pretty much stayed stable across the board. There has been some inflation since this started, and it's because of supply and demand, but there were a couple items that just went crazy, and they're commodity items. And that's the way it works on that with commodities. As you know, they're traded on the Chicago Board of Trade, and commodities go up and down based on supply and demand. Well, eggs, and I'm sure any of you that shop a lot know that our cost tripled on eggs within a 2-week period. The price tripled. So, if we were paying 75 cents for eggs, we're paying 3 times that within a 2-week period. And of course, when your cost goes up, you have to raise your retail, so you get that little bit of profit to pay for your labor and pay for the electricity and so forth. So, so egg prices shot through the roof. Well, at the same time that's happening, you're hearing on the news about price gouging and things like that. And that does happen, not in our industry so much. It happens with gasoline and things like that, sometimes, and there's laws against that. But people are hearing that, and then they're seeing egg prices triple. Well, they're thinking that we're price gouging. So, we had a few people that were saying, hey, you're price gouging and you're trying to take advantage of the situation. And that hurts me, to hear that personally, because I know what the situation is. I know they don't know that. They don't understand that the cost went up so much, but I'm trying to explain that. We're putting things out on social media, but things like that, we're probably some of the worst things you want to hear during times like that, but it was very few. Most people were very understanding, and certainly when you explain it to them, most people still, they get it, they understand it at that point. But that's tough when you have to take a price increase during a time like that. But eggs was a good example of that. That was probably the biggest example of that. You're seeing it in meat now, and I'll talk about that in just a minute. But that's another commodity. So we still have issues right now with certain categories. Toilet paper is still, we actually get some now. And throughout that, that was another item that some of the people complained about because they didn't understand. You couldn't get toilet paper anywhere. I mean, the only way you could get it was if they happened to get a couple cases in on their delivery and you happened to be there for one of the first customers in the morning, and you might have gotten your 2-pack limit. But for the most part, you couldn't get toilet paper for a few weeks there. You couldn't get it anywhere. And so, again, we were trying to think outside about where we went to every supplier we could think of, places we've never bought from before, and set up accounts with people we never had bought from before. And we bought some commercial toilet paper that they use, it's a single roll that they use on, in retail establishments, where they use it, not sell it. And so we bought a truckload of that, bought 2 truckloads of that, and brought it in the store and sold it by the case, by the half case. And we went through it really quick. But again, you had people that didn't understand that because it was like $1 a roll. Well, we paid 97 cents for it. So we were making 3 cents, which isn't enough to cover my cost by any means, cover labor and cover the bills. But they thought we were price gouging. Well, they didn't look and see that roll was a 1,000-sheet roll. That you compare the price to like Charmin or Cottonelle, those are 300 and something sheet rolls. So it's 3 times the amount you're getting, and the price was way lower. Well, to them, $1 a roll was a lot. So you're getting complaints, when you're trying to do the right thing and you're getting complaints from people, but it's just because they don't understand what the situation is. So, but we nevertheless, we sold those 2 truckloads in no time because people were just hoarding toilet paper. But I say that to let you know the things that you go through to try and get product just to get it on the shelf. And I don't think there's any better example than toilet paper. I think everybody here knows that's just something that for some reason, I don't know why anybody would need to use any more than they ever did, but they sure were buying more than they ever have in the past. And it just put such a strain on the system that they still haven't caught up. So it's going to be, probably another month or 2 before we get back to some semblance of normalcy on toilet paper, and paper towels is the same way. So anyway, there's a lot of categories that we still have issues with. The biggest categories that no matter where you go, you're going to see issues is the paper aisle with toilet paper, paper towels, things like that. The dried bean section, pasta and pasta sauce, canned meats, soups, cleaners, anything that has anything to do with cleaning, Lysol, bleach, ramen noodles, canned vegetables, rice. Those are the sections that were extremely hard to get product for, and we're still having issues getting some product. We're in better shape. Certainly everybody's in better shape now in the industry than we were a few weeks ago, but all those categories are still, they're way behind on. And those categories are the ones that got hit the hardest because those are what people buy when they're going to hunker down and they're going to, they've got to stay in their house, where they're going to buy things that are canned and easy to make and easy to prepare and have protein and things like that. So, there's other, even peanut butter. Peanut butter was hit hard by that. I know Jim mentioned earlier about Jif, Crunchy Jif, in one of our meetings earlier, and I've searched Crunchy Jif, even all our competitors, nobody has it. And it's because they got so far behind on it, they weren't making it. So, there's certain categories that just got decimated by this. And so it takes a while for the supply chain to get caught back up. And and I stay on top of that. I've got the list here if anybody has questions later, but And they kind of got a list of what the outlook is on that. And most of it's like July. By the end of July, most of that will be back in pretty decent shape. But some of it, like paper, they're saying September. So just a huge strain on a system. It takes a long time to catch up to that. So anyway, the other thing that came from this was that, as crazy as this sounds, after everything else I just told you, there's a huge amount of waste that started taking place on the production side of the business. Not our place in the supply chain, but it's on the production side. And that's because of what I talked about earlier with like one of the biggest categories to take a hit was dairy. And so a lot of you probably saw on the news or read somewhere in the news that about milk being dumped, and they were just dumping tens of thousands of gallons of milk. And after everything else I just said and everything you know about what's gone on during these last 10 or 11 weeks, you think, why in the world would, as much as people are buying, why in the world would we be dumping tens of thousands of gallons of milk? And it's because of when this happened, all the schools shut down, which is a huge outlet for milk production. They were all shut down across the country. And everything that goes with that. I mean, it was affected that. The restaurant shutting down, they use a lot of milk, whether it be, not necessarily to drink, but in the recipes and everything else. So all of a sudden, these dairy farmers don't have anywhere to go with the milk because those places are closed. So what do they do with the milk? I mean, dairy cows have to be milked 3 times a day minimum. They have to. And they will literally, if you don't milk the cows and you try and think, well, I'm just not going to milk the cows. If you don't milk the cows, they will die. So it's not a choice of whether you milk the cows. You have to milk the cows. Well, if you don't have anywhere to go with that milk, what do you do with it? So they're dumping tens of thousands of gallons of milk, and that's been going on, for the last many weeks now since this started, or a couple of weeks after it started, because that's when it hits, when there's no outlet for it anymore. So the Dairy Farmers of America, which is their trade association, they estimate that the farmers are dumping as many as 3.7 million gallons of milk each day, so across the country. So I mean, it breaks your heart to see that, and it certainly breaks their heart. That's stuff that they were selling before. So this has had a huge effect on farmers, not just dairy farmers, but they were the hardest hit. But this has really affected the farmers tremendously. So the large consumers of dairy, like the schools, coffee shops was another one that were closed. Most of the coffee shops were closed. Well, they're a huge buyer of milk for their shops. Well, they were all closed. So they lost a lot of that business, and that left the processing plant with fewer customers at a time when the cow production of milk is at its fastest rate this time of year. So just the perfect storm for them. So about 5% of the country's milk supply is currently being dumped, and that amount is expected to double if the closings are extended longer, which most of the closings are not. Most of even the bigger cities are starting to open up now. So hopefully that prediction isn't going to come true. If we were to have to close again or something, that the pandemic were to get worse or reappear in the fall, then that may happen. But they're still dumping milk as of now until things get back to normal, because restaurants are nowhere near back to normal. Schools are still closed, of course. Anyway, that's a hard thing to watch and to see those farmers go through. So to prevent them from dumping further, some of their farming groups that represent them, they're trying everything they can to send the excess milk. They're even lobbying pizza chains to put more cheese on each slice of pizza, just to try and get more milk production and get them to buy more milk. So they're doing everything they can to try and find an outlet for that, because they don't want to dump it. They don't have any choice. There's logistical obstacles that prevent them from being shifted to other food service customers that are in retail. You can't, like I said earlier, that we were probably the only ones that bought those little cartons of milk. Nobody else bought those and is going to sell those. You can't sell those at retail. the other product that they package or put together for other people that aren't in our industry, you can't sell. You can't just send it over to grocery stores to sell. So like cheese, for example, that they make from milk, the machines are designed to package shredded cheese in huge bags, like, 5-10 pound bags that go to food service, go to restaurants. And the milk that I mentioned earlier in the small cartons, and the machines are set up for that. So you can't, they can't put it in retail friendly packaging that we can sell in the grocery industry. And to try and change that, you'd have to change all your machinery out, which would take a huge cost and a lot of time for them to be able to do that. Well, by the time they do that, it's probably, this was a temporary thing. This wasn't something that's going to change the business forever. So it's not something that they could easily just change and package for retail. So that was what was happening on their side, with farmers. And that's just on the dairy side. The cattle and all that is another story. But I asked the same question. I'm sure a lot of you are thinking the same thing, is, why don't they do something else with that? Why are you dumping it? And that seems crazy. Why aren't you giving it to people who need it? Why aren't you giving it to the needy, to the poor, to the, sending it to other countries and things like that? Well, they have, to the extent that they can, because they would certainly rather do that. But you have issues there too. So, they've sent what they can to food banks and Meals on Wheels and places like that, which have been overwhelmed with demand, because throughout all this, you have 40 million people out of work too. So there's a lot of people that there's more need. And I'm sure Ruthie would attest to that. Pat probably knows that from the Caring Place side. I'm sure that I don't call it business, but those groups are up tremendously. People are needing more food. So they're overwhelmed, and they need, there's a bigger demand for that. But they can only take so much. It's perishable. You only have so much space to put perishable product, so many freezers and so many coolers. If it was dry grocery, well, then you find a way. You can get a warehouse and you can stock up on that. But when it's something like that has a short shelf life and you need a cooler for, they can only take so much. Then you have logistical problems. How do you ship that all across the country when you can't find truckers to ship that? And you're going to have to pay a lot of money to do that. Well, these farmers have been hit already and hurt financially. They're not able to find trucks to ship stuff to places where you're just giving it away. They're not going to have the money to do that, and the places don't have the means to store that either. So it's just crazy how it works. But that's just, when something happens that quick, there's just no way to there's no outlet for it. But to the extent that they can, they have sent what they can to the charitable organizations, but there's a lot of issues with trying to get that done too. Shipping it overseas was just almost impossible because of having the transportation to do it, paying that cost, and getting it into countries that are dealing with the same problem, that have kind of shut down their ports and things like that is another issue, that you just can't easily do that. Over the past few decades, the food banks have tried to shift what they're offering, their constituents to mostly processed meals and serving fresh produce and things. But with the pandemic, it's caused a shortage of volunteers at some of those, and I know Pat and Ruthie could speak to that, but they've had a shortage of volunteers, and it makes it difficult for fruit and vegetables, when a time when it's expensive to transport and everything else. So it's kind of been the perfect storm for all of this, and it's happened so quick and to such a large degree and globally that it's just, some of those things you don't think about until you have to face it. But also the cost of harvesting, processing, and transporting produce, it puts a financial strain on them that they just can't do at this time. Half of their paying customers were gone. So you can imagine what that did to the farmers financially. And then to expect them to find ways to ship things across the nation to places that would need it is just not feasible. I don't think you could even find the transportation to do it. But farmers are learning real time too on how to deal with this. They're just like we had to deal with things we never dealt with before. They are as well. Some of the things I just talked about, but then also, things that they've never had to deal with before. Like, for example, the quarantine has shown the farmers, just how much vegetables Americans eat when they eat at restaurants, as compared to when the restaurants are closed and people are eating at home. They don't sell anywhere near as many vegetables as they do, when they have to cook them for themselves at home, nowhere near as much as they do when the restaurants are open. Well, that's not something you would think about. I mean, they've never had to face before. So now they've got the product, and what do we do with it? So an example that they used was onion rings. People don't make onion rings at home, is what they said. I'm sure people do, but it's to a small degree. You go to a restaurant, you freely order it. Well, they sell a lot of onion rings. So they buy a lot of onions. Well, an onion farmer is impacted greatly by that because their consumption drops tremendously. Well, now what do we do with all those onions? So onion farmers were having to think outside the box too. And what do I do with that? So their packaging of some of them were packaging them in 50-pound bags and trying to sell them retail through outlets like ours. So, I mean, this has affected everybody along the chain, and farmers were impacted with it tremendously, from vegetables to dairy, like I talked about, and certainly meat, which I'll talk about in just a second. Let me get to the meat now. So most of you have seen, if you hadn't shopped in the grocery store in the last few weeks, or heard about it, you've probably seen it on the news about the price of not just beef, but beef, pork, and chicken spiking in price tremendously. And we kind of knew that was coming to a certain extent, not to the extent that it has been, but and each of those categories have been affected a little bit differently. Chicken hasn't been a huge problem, but it has gone up, and it has been in some short supply. Beef and pork have been affected tremendously. If you've gone to, we've stayed in pretty good shape throughout. And again, that's because, we've had some issues with it for sure. But again, I think we've been in much better shape than our competitors. And I go in and check them a lot. We all do. We all check each other. Walmart's been totally out in their meat department at some times, and some of our other competitors have as well. Of course, Walmart sells prepackaged meat, so they don't cut anything at store level. So they have to get all theirs straight from a packing house. But, it's been in short supply, as well as the price going up. And it all comes down to supply and demand. But the prices have been skyrocketing. Beef has gone up tremendously. Even hamburger gone up triple to quadruple in price, cost to us. And it's just in such short supply. But some of the stores you would go in and you can't get what you want at all in those categories. And if you do get it, you're going to pay more for it. So it's a supply and demand thing. I'm sure all of us learned in school about supply and demand. And when there's a huge demand or a short supply, or in this case, both, then you're going to have price increases and you're going to have supply issues. So, so what's crazy though is, and if most of you probably don't know about cattle prices, but some of you probably do. I know we got some people that know about that, or have people in their family that are in farms. But cattle right now is, if you were to buy a steer and go, if you were a farmer, you'd pay about 90 cents a pound for cattle, but yet you're paying $5, $6 a pound for ground beef. You're paying, $7 a pound for a chuck roast. I mean, it doesn't make any sense. So people are thinking, well, what's happening? You pay, I can go buy a cow and pay 90 cents a pound myself, but to get it to me and to cut it up and get it to me, you're going to charge that much. Well, why is that? Is there a shortage of cattle? That's not the case at all. So, just because restaurants closed, it shifted, and people are buying that product at home. They may not have gone to restaurants when they were closed. They couldn't and get a steak, but if they want a steak, they can go to the store and get it. It didn't put, it isn't a supply issue, and it hasn't been a supply issue at all when it comes to meat. There's plenty of cows, there's plenty of chickens, there's plenty of hogs. So this isn't a supply issue like it has been in the past. And you see this with commodities. So you've seen prices go up on certain commodities like beef or pork or chicken at certain times when there's an issue with like, there was avian flu, and that affected the chicken, all, poultry. And so when a lot of chickens die from a disease or you have something like that going on, well, then you have a shortage and chicken prices will go up, and that will affect it for a while until you get, something to solve that medical issue, or you've raised new chickens and kept them quarantined. That takes a while for that to happen. So chicken prices go up. You've seen it with pork, with the swine flu and, H1N1. There was several things that affected, the animals that have caused shortages and caused a lot of death with the animals and or diseases, and therefore you get a short supply, the price spikes. But those things in the past have all been a certain commodity and for a certain amount of time, and the price spikes were due to shortages of supply. With this, and the price have gone up more than any time ever, there is no shortage of supply. So you wonder, what is the problem then? If I can buy a cow at 90 cents a pound and there's no shortage of supply, why in the world are the prices higher than they've ever been? The whole problem is the packing houses. So the farmers, again, are taking a huge hit on this, just like they did, like I talked about earlier. Well, it's the same thing in the beef and pork and chicken industry, especially beef and pork have been the hardest hit. But they've got plenty of supply, but they go to from there it goes to the processor, and the processors are the ones that slaughter the animal and cut it up and send it in what we call primals to our store, and then we cut it from there. Well, the processing houses were closing, and because of the coronavirus, these people work very close together. I don't know if you've ever seen any videos or anything of packing houses, but they work very close together. It's not fun to see. It's not a good sight to watch the processing of animals, but in these packing houses, the people work very close together. And if somebody gets the coronavirus, then it's going to spread pretty quickly through there. So, when this started early, people didn't know about it, and it was already spreading. A lot of the people in those packing houses were getting the virus. Well, that takes them out of work. They're gone. They're quarantined for at least 2 weeks, and they're not in the plant. Well, that happened to a large degree, and so, and they certainly wanted to protect the food supply. I don't think it spreads through food at all, but still, they want to protect their people and the food supply. So they're sending these people home. Well, a lot of the packing houses just started closing, just started shutting their doors, and so now the farmers have nowhere to go with their animals, and nobody's buying it because they're not processing it. So it got to the point where, hundreds of packing houses were closed. So on April 28th, the president signed an executive order. He used the Defense Production Act to order them back to work. Obviously the people that are sick aren't going to go back to work, but that makes with that act, they can't close their plants. They have to at least still keep working with the people that they have. So that's helped a little bit, but that didn't happen until April 28th. And again, still, just because you order them to stay open doesn't mean people are going to come back and work. If they're sick, they're sick. If they're not going to come to work, they're not going to come to work. So, and you can't just pull people off the street to come in and do that. It's a skill. You have to know how to do it, and it would take weeks to train people to do it. So you can't send in the National Guard or somebody like that to cut meat when they'd had to be trained to do it. So that affected the supply, not the supply. It affected the food chain tremendously, because the farmers have nowhere to go with it. So like I talked about earlier with the pouring out of milk, and you've probably seen that on the news. Same thing's happening with animals, and it's horrible to think about, but there's been thousands of animals that are just being gone. They're just lost. They have to kill them and bury them in huge mass pits because there's nowhere to go with these animals. And so, you think, well, why don't they just wait longer to kill these? Why don't they just keep the beef around longer? Or, why are they having to kill them? Well, there's a whole process. And like I've talked about with just about everything today, there's a chain. So beef, for example, and it's like this with all the commodities, but a farmer's got, they have the calves, and those calves stay in a certain field. with the mothers and with the mother cow, and they feed with the mother cow and they stay there for a certain amount of time. And then when that time is up, they go to the next level and they're put into a different field. And at that level, they're grazing on grass and they're in that area for a while. And then after a while, at a certain time, they go to another field where they have grain, and that's like they call it the finishing, where they're finished, and that's where they eat a lot of grain and they put on their weight and so forth. And then they're ready to go to the packing houses. Well, you can't stop that process overnight. So, that chain has to keep going. If you keep those, when they're at that final stage, if you can't sell them to the packing house, then what do you do? Well, if you keep them around, first of all, you got to have pasture to put them somewhere. You got to have somewhere to put them. As they age, they're worth nothing anymore. You have to do it at a certain time, but you've got that group behind them coming along that you've got to put in that field. So there's just nowhere to go with them, and there's nobody to buy them. So unfortunately, they're just, they have to kill some of them, and that's happening with all of them, mainly beef and hogs. But it's been a total packing house problem, not a supply issue. So that's starting to get better.
Jim,
Yes.
you're getting low on time, and you might
Okay.
want to have a minute
Okay.
or two for questions.
That was my last part. So anyway, that's getting better. I learned yesterday that we're about done with that. Prices are starting to come down. So I think you'll see that that problem take care of itself here starting this week. So that was my last part. So that worked out good. Any questions from anybody?
Great job, Jim.
Sorry it took so long.
Lots to
Absolutely.
cover.
Yes, that was
Very informative.
absolutely. I have one question. Have you seen any spike in like the seafood industry? Has any of that gone up?
It's gone up some, not like the others though, and
Okay.
not as big of a shortage. They weren't impacted as much. You still had some issues there. It has gone up some. There has been some shortage, but it's been better than the others.
Okay.
Yeah, that's so
Jim,
good, Jim. Thank you.
this is Jim Davis. I think that people would rather hear from you where they can find toilet paper than listen to a politician.
We have some, so at many of our stores, and if we don't have it, we'll get you some.
Jim, I thought that you guys buy the beef, a lot of it with the local farmers. Is that true?
We do to the extent that we can. There's not a lot of packing houses around here. So we do to the extent that we can. And produce, we buy all the local produce we possibly can. So like Granger County tomatoes, we buy locally. All the produce we can buy locally, we do. Everything we can source locally, we do.
I tell everybody that if you want to buy meat, you got to go to Cooke's food store. They have the best meat. I tell all my clients.
Well, thank you for that. We appreciate
Go
that.
to Cooke's food store to get the meat, and they have best groceries.
Thank you.
They have the best everything, not just the best meat.
Lisa.
I know, but
Yeah, the best
you know,
everything.
Very
I
true.
know. I also tell them you get the local fruits and vegetables, and so, and yeah, this is the only local stores that we have. They have the best products.
And their
Thank you.
deli is amazing too.
Yeah.
Thank you. I didn't pay any of them to say that, so.
Yeah.
And are there any other questions?
Jim, what is the major difference between supply lines between a local grocer or regional grocer or a national chain like Walmart? Like, because I mean, a lot of the products are the same. I mean, Frito-Lay is Frito-Lay, and
Right.
a lot of those types of things. So, but like you said, you can see gaps in supply chains probably revealed in a way that we haven't been able to see in years, right?
Right. Yeah, that's right. The main difference is that with all of our competitors, and I would say, when I say that, the big chains, talk about Walmart, like you mentioned, even Aldi, Food City, Food Lion, who am I missing? Publix. All of those here in town, they're all big chains, and every one of those are self-supplied. So they have their own warehouses, and they buy their own product. They buy their product from the manufacturers and put it in their own warehouse. For an independent like us, we're part of a cooperative, and we buy from our warehouses in Nashville, and we buy from that warehouse. But we also buy from anybody else that we can. You know, with a chain, they control it much tighter, and they have to buy from their warehouse, and rightfully so, because they want to sell their own product. We have a lot more latitude because we can, when something like this happens, I'll go out and find any supplier I can where I can get that product, and so they don't have that latitude to do that, or at least not at store level or local level. They're going to have to do it at their national level, and everything just takes a lot longer because it's just like the federal government. It's a bigger bureaucracy, and the wheels turn a lot slower. So,
I mean, is it fair to think of your supply chains as statewide, or do you think of them as I guess what I'm saying is, how does it compare, like, to if we were in New York, if you were an independent seller in New York, or is it just, because it's obvious that there are differences in the supply chains, right?
Yeah.
How does Tennessee stack up, I guess?
Well, like ours comes from Nashville, and that warehouse services probably a 10-state area outside of there regionally. So in New York, you're going to have obviously more warehouses because of the density of the population. But an example you like to use with Frito-Lay, that's what we call DSD, direct store delivery. Those type of things like Coke, Pepsi, Frito-Lay, bread, those items are brought in from that vendor directly to us at the store. They don't come through the warehouse. They come on a truck directly to the store. And those items are pretty much the same, like you said, across the country. Frito-Lay is going to bring it to your store no matter who you are, where you're at. And those don't have to go through a warehouse. So that's the case with all of those type of items. And you see their trucks on the road, so you kind of know which ones those are. Little Debbie and Frito-Lay and, milk, bread, Mayfield, things like that.
Okay.
The rest of it does come through the warehouse, and that's pretty much depends on population density.
Jim, I just want to say from the carrying place, from the board at the carrying place, yes, our numbers have been higher servicing clients the last few months here. And Cooke's Food Store is not a part of Feed America program. And that means you get assigned to an organization, but y'all give all those extras directly to the carrying place.
Right.
And we're forever grateful. We go through that stuff, give it out immediately. Anything that's left over like that, thank you. We sure do appreciate it.
Well, thank you, Pat. We try, as the only locally owned grocery store, we try and take care of your local, take here to, that goes through our hands stays local, and we take that seriously. We want to take care of our community. So Caring Partners, we're glad to be partners with Caring Place.
Do we have any other questions?
Thank you so much, Jim. That was outstanding.
Great.
Thank you, Bonnie.
Jim, that really was. Thank you. And so much goes into it. You don't. It blows my mind.
It seems easy, I guess, but it's
it's not at all. Yes. Cheryl wants to take just a minute to address next week's meeting.
If everybody or anybody feels comfortable about having a early morning social next week at 8 o'clock at the press, you're welcome to join us. If you're not comfortable with that, we fully understand. We just thought it might make a little bit of a change and a little bit of a difference. So again, you're welcome to come out and join us. If you're not comfortable with it, there's gonna be no retribution or hard feelings or anything like that. Let me also say this, in the middle of a global pandemic, I never would have done a complete kitchen gut job if I'd have known what was coming. It's been awful. The only thing I've had is eggs. I just had no way to cook them. So, it was a 4-week ordeal that turned into 12 weeks. So it was awful. But good job, Jim. I was always able to go into Cooke's. Your cashiers are so friendly. Your bag boys I really love. And Barry on the microphone is a hoot. So roll Tide.
Thank you.
Thanks, Jim.
Yes,
Thank
Thank you,
so
Jim.
much,
That
Jim.
was awesome. Thank you.
You're welcome. Thank
All
you.
right, and if you guys would join me in the four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned?
Concerned. Will
Mm-hmm.
Will it build goodwill and better friendships? Will it be beneficial to all concerned?